I've been working for the World Bank, and until the year 2011, when I was on a project for the World Bank in Sierra Leone. That's where I started having prostate problem. I had a serious retention, and that kept me for about 2 weeks in a hospital in Sierra Leone. Came back after 2 weeks to Ghana.
We have been having treatment, going for treatment, visiting urologists, and he's been put on Zatral, finasteride, and other antibiotics anytime he had infection.
I was given a series of tests to go through in preparation towards prostate surgery. But then it was discovered that I had a very serious DVT problem. And this prevented the doctor from carrying on the surgery. So I had to be put on regular medication. This didn't help because occasionally I had retention again, and then I had to be put on a catheter, which I know is really very, very hurting.
He was suffering a lot. Sometimes it involved catheterization, which he found very uncomfortable. And for the years that it's been like that, sometimes there will be infection and would have to go back to hospital.
And I remember in the course of wearing catheter, one moment I started bleeding seriously, and I didn't know what to do. All this went through from the year 2011, not until February 2019, when I discovered Euracare.
When we came to Euracare in February 2019, we were told that he could have some relief if he was put on a non-invasive or minimal invasive surgery, which they called prostate artery embolization.
I was rushed here in a serious condition. Then I had to go through the surgery here, which to me was like a child, playing on it, because I could see what they were doing on a computer monitor. And there was no pain, and I just couldn't believe that that was really going to give me a relief.
My husband went through it successfully, and it took the same day for him to go home. And since then, his quality of life has improved tremendously. His energy is high, and he's not even waking up many times in the night even to go to the urinal. And we do not have to pay so much for medications as we used to. And I'm so excited about that.
Prostate artery embolization is a new treatment modality that we have introduced here in Ghana, and we are getting fantastic results with our patients. A lot of men, especially people over the age of 60 years, will have some symptoms of urinary tract obstruction. And often there are a lot of treatment options, including surgery, medications, and other treatments. But now we also have an additional new way of treating benign prostate enlargement called prostate artery embolization. This is a very simple, minimally invasive treatment, and these days we actually go through your arm all the way to the prostate, and we block off the arteries that supply blood to the prostate. By so doing, the prostate shrinks, and the symptoms that normally are associated with prostate enlargement disappear. And many of our patients, such as Mr. Amponsa, are beneficiaries of this procedure.
I think this is a very good procedure that I recommend for people who are suffering from prostate or battling with prostate problems?
My urine flows naturally without trouble, and I feel quite good in myself.